Okay, so what's your name?
My name is Peter Stepanek.
Okay, Peter, we're going to be doing a physical exam on you today, okay?
Okay.
So first, I'm going to look at your build.
Okay.
Okay, so your build is, maybe you could stand to lose a few pounds, maybe. Okay. Now, your posture is actually very good. You have a very straight posture. Your breathing, just from looking at you, it just seems like you're breathing regularly, like you're not in any respiratory distress. There's no grunting or anything like that, or no use of accessory muscles. State of awareness. Can you tell me what month it is right now? Can you tell me the month?
Month is December.
Okay, and what's your name?
Peter
And
Stepanek.
where are you right now?
In my living room.
Okay, good. Okay, your behavior is appropriate to the situation. Your speech is clear. It's not garbled or anything like that. Your orientation is appropriate for the setting. Facial expression is also appropriate for the setting. Mobility, how do you get around usually? Are you able to walk and perform?
Yes, I can walk, I can run.
Okay, and are you able to like perform your activities of daily living, like taking a shower and brushing your teeth and feeding yourself?
Yes, I can. I'm doing that.
Okay, good. Okay, so that's the end of the general investigation. So now I'm going to look at the color of your skin and the color of your hair.
Okay.
So the color of your skin is appropriate for ethnicity. The temperature, it's warm, which is good. The turgor, which means that you can check if it's dehydrated or not. There's no tenting. The skin bounces back, so that's good. Hair distribution is good. Still have a full head of hair. Do you have any scars on you?
I don't have any scars.
Okay, and there's some moles on your face. Are there any, when we're checking the moles, we want to be checking A, B, C, D, E. So A is for appearance, B is for borders, C is for color, and D is for, I'm not sure what D is for, but E is for equal, if both sides are equal. So none of the moles on your face appear cancerous, so that's good. There's no lesions. Your scalp shape is appropriate. The nail color, your nail color and nail shape is appropriate. Capillary refill, which is testing your circulation, is good. When you press it, the color comes back to the nail. Okay, face and head symmetry. Face and head appear symmetrical. The sclera of the eye and the conjunctiva of the eye is clear, like there's no cloudiness in the eyeball. Perla means pupils equal, round, and reactive to light. So we can, how you test perla is you have a flashlight and you check to see if the pupils dilate if they like get smaller in reaction to the light. So that's how you test perla. So he has perla. Carotid pulses, so that's the pulse on your neck right there, so that's good. Is the trachea midline? So this right here, the trachea is midline. The thyroid, so palpating the thyroid like that. And then the sinuses, the frontal sinuses looks like they're all good. There's nothing like in them or anything like that. So I'm going to now, one second. Okay, so I'm gonna check your ear color and your symmetry using the light. So I'm gonna look and see if there's anything in your ear. You have maybe a little bit of a wax buildup, but it's nothing crazy. Okay, so your nasal mucosa, I can look inside your nostrils. Okay, that's fine. Nothing appears abnormal there. So your oral pharynx and your tongue. So you can stick out your tongue. You can like, yeah, you can see, if you can see the uvula, which is the thing that hangs down. You can wiggle your tongue like that. Okay, tongue is symmetrical and appears midline. Hard and soft palate. The hard palate would be, I believe, what is on the upper side of the mouth. The gums, mucosa. Okay, so teeth like appear maybe not in great shape. A little bit of discoloration on the teeth, but that's fine. And then the lymph nodes, so you palpate the lymph nodes. They don't appear to be swollen or anything like that. So that's good. Okay, so now I'm going to check your respiratory character. So I'm going to see if there's any adventitious lung sounds I'm going to see if there's any adventitious lung sounds. So I'm going to do that by using the stethoscope, and I'm going to listen to your lungs both at the scapula, like right here, and also in the back. And I'm also, while I'm doing that, I'm going to check the chest expansion. So, okay. Okay, so can you take a deep breath? Okay, let it out. Okay, let it out. Okay. Okay, you can take a deep breath again. Okay, let it out. Okay, and now we're gonna do the back. Okay, take a deep breath. Let it out. Okay, take a deep breath. Let it out. Okay, that's very good. I didn't hear any any wheezing or any rhonchi or coarse lung sounds, so the lung sounds appear clear. So now we're gonna do, we're gonna listen to the heart. We're gonna listen to the heart sounds and the carotid artery. We're gonna look for edema. We're gonna look at the posterior tibial and dorsalis pedis on the feet, and then the popliteal is on the knee, the femoral is on the thigh, and the brachial is, I forget which one the brachial is. Hold on one second. One second. Okay, brachial is the pulse in the arm. I thought that was like radial pulse. Like, yeah, I thought that was radial pulse. Okay, so we can test the radial pulse by going like that. Yeah, I feel the radial pulse. And it's also important to check to see if both pulses, or if you can hear it bilaterally, because if you can't, that might be a problem with one of the limbs. So carotid is right here, like I said. This is brachial. I think it's slash radial also. Brachial / radial. Femoral is on the thigh. The popliteal is the knee pulse, like right here. And then there's the posterior tibial and the dorsalis pedis. And then also it's important to check for edema, especially like in the legs. Edema can build up in the lower extremities or in the hands. Okay, now we're also going to listen for the apical pulse and the heart sounds S1 and S2. Okay, so the S1 and S2 is like the lub-dub heart sound, and you're only supposed to hear S1 and S2. You're not supposed to hear like S3 and S4. Okay, good. Okay, so I heard the lub-dub, the S1 and the S2 heart sounds. Okay, now we're gonna do the chest. Okay, we're gonna do there's like, the chest is symmetrical. There's no masses in the chest. Okay, we can see the arms are at the side. The arms, can you lift your arms overhead to see like how the chest, yeah, like if there's anything wrong with the chest, like the chest muscles or anything, you can see that, but that looks good. You can put them down. Okay, can you press your hands against your hips and lean forward? So this way, like maybe we can see if there's anything wrong with like, you can go back up. You can see if there's anything wrong with like, with the hips or anything like that. Okay, so now for the abdomen, we're gonna inspect for symmetry of the abdomen. We're gonna check for bowel sounds. So when you check for bowel sounds, you check clockwise. Yeah, I definitely hear bowel sounds. Okay. Okay, good. Okay. So now we're going to percuss on the abdomen. And then we're going to test head and neck strength. So, you can like move your head from side to side. Okay, upper body strength. Can you press against my hands? Like press this and now pull me towards you. Okay, good. Okay, so upper body strength is good. And now we can do lower body strength. So you can, what I usually do to test for lower body strength is I have the patient sit, so you can sit down. Oops.
Okay. That's okay.
You can sit down and you can like press your feet up against, yeah, so press like that.
One.
Yeah, and then the second one. Okay, and then, okay, good. And you can press against my hands like that.
Okay.
Yeah, so that's usually how I check for strength. Okay, so, and muscle tone of extremities. Seems like pretty good muscle tone actually, like doesn't really seem that there's any like muscle wasting or anything like that. Okay, so now check range of motion for the shoulders. So like shrug your shoulders like that, move your elbows like that. Okay, wrists go like that. Okay, fingers, see if you can like wiggle your fingers. Okay, and hips, we did hips like you can when we move them from side to side. Now you can wiggle your feet like that. Okay, good. Okay, good. Okay, spine, we can check the spine, see if there's like any spinal deformities or like curvature of the spine. Okay, good. Okay, so now we're gonna test your balance. So we're gonna do like heel to toe walking. So walk like that, like you're trying to walk in a straight line. Okay. Okay, good job. And now we're gonna do the Romberg test. Okay, you can go back there. Now we're gonna do the Romberg test, which is when you stand with your stand like this. Stand with your arms out and then your eyes open, okay? And now you can close your eyes and we can see if your balance, if anything happens with your balance, but your balance looks good, so you can open your eyes. Okay, now we're gonna do pronator drift, which is when you go like that, like stretch, right. And so what we're looking for is if one of the arms or hands like drifts down like that, that could be a sign of a stroke actually, if something, yeah, but you're good. Okay. So now also what we do is we do the what I do is like touch your nose and then touch my finger. Yeah, and then touch my nose and then touch my finger. Good. And touch my nose and then touch my finger. Okay, good. And then also what I do to test coordination in the lower extremities is take your heel and run it up and down your shin. It's kind of tricky if you're standing. Yeah, good, good, very good. And do it here. Yeah, that's good. That's good. Okay, so now what we're gonna do is you can close your eyes. We're gonna test sensation in your arms and in your legs. So what I do to test for this is I do, so which arm am I touching?
Left one.
Okay, which arm am I touching?
Right one.
Okay, which arm am I touching?
Both of them.
Okay, good. Okay, so now we do which leg am I touching?
Left one.
Okay, which leg am I touching?
Right one.
Okay, which leg am I touching?
Both of them.
Okay, good. So that's how I test sensation in the lower extremities. That's also, if you have a stroke, that's gonna be something that is gonna be decreased. Okay, so now we're going to test the patellar reflex, which is the knee reflex. So you can actually sit back down. Okay, so we're gonna hit the knee. So that's how we test the knee reflex. For ankles, I would strike the Achilles tendon right there. And then for biceps, that would be the front of the arm. So I would check the bicep by kind of like with the reflex hammer, I would check the bicep by hitting the front of the arm. And then I would check the bicep, and then I would check the tricep, which is the back, by hitting the back. Okay, and the plantar reflex, that's like the foot reflex. So I would I would hit the foot, that's checking the foot reflex. Okay, so now we're gonna do the cranial nerves. So I would test the cranial nerves by putting something in front of you like coffee or like a vanilla scent and having you identify that. So optic nerve, the optic nerve would be using the Snellen chart, which is just like the vision chart, just to see how your vision is. Sorry, that would be optic nerve number 2. Olfactory is optic nerve number 1. So the cranial nerve number 3 is the ocular motor. The cranial nerve number 4 is the trochlear, and cranial nerve number 5 is the abducens. So that would be like extraocular movements. So just like testing how your eyes move, and then like testing like how many fingers am I holding up?
2.
Okay, how many fingers am I holding
3.
up? Okay, how many fingers am I holding
4.
up? How many fingers am I holding up?
5.
Yeah, so you can test how the eyes like track. The trigeminal, the cranial nerve number 5 is the trigeminal nerve, and that's that's like the right here, and so you can check that by having the patient clench the teeth or also smile. Also, you can see like the sensation right there, like to see if the sensation is intact. Cranial nerve number 6 is, cranial nerve number 7 is the facial nerve. So you test that by if you can raise your eyebrows. Okay, frown. Okay, good. Close your eyes tightly. Okay, you can smile and okay, puff out your cheeks now. Puff out your cheeks like that. Okay, good. Okay, good. Acoustic is like, that's when you do the whisper noise test. So you whisper something in the person's ear and you see if they hear it. And you do that for both ears. The glossopharyngeal nerve that's when you check like the tongue, if the tongue is midline, if it moves around, and you also assess if the uvula is midline, so you can stick out your tongue so that's again like that's checking the tongue. The spinal accessory nerve, that's shrug your shoulders and assess for strength. in the trapezius muscles,
Okay.
and then turn your head from side to side. Okay, and then hypoglossal, that's like stick out your tongue for symmetry in midline again. Okay, and then wiggle it. Okay, good. So that's basically it. The only other thing I forgot to do is maybe the kidneys, which are on the back side,
Okay.
and the abdominal bruit, and also the femoral bruit, and that's the kind of like the thrill sound. Like a bruit is like a thrill sound, and the femoral one would be on the thigh. So yeah, so that's about it. Thank you for doing the physical evaluation.
You're welcome.